afternoon, class. Today we are going to talk about the topic of depression. I'm Cindy and my partner here is Jake.
The definition of depression is a common mental disorder characterized by sadness, loss of interest or pleasure, feelings of guilt or low self-worth, disturbed sleep or appetite, and feelings of tiredness and poor concentration. Depression in the past was seen as a spiritual illness rather than a physical one. The treatments for individuals suffering from depression or melancholia, as it was called back then, were a lot more savage than present treatments. Without getting too much into detail, treatments included starvation, trepanation, torture, and individuals. Over 318 million people live in America today, while Australia only holds 23 million. In comparison with Australia, depression in America is more prevalent due to the huge population gap. 1 in 10 Americans are affected by depression. Over 80% of people who show signs of depression are receiving any specific treatment, and unfortunately, the number of patients diagnosed with depression increases by around 20% each year. A majority of the individuals suffering from depression in the United States are found in Louisiana, Arkansas, Tennessee, Alabama, and Mississippi. Additionally, women are twice as likely to experience depression. Around 12 million females in the United States alone experience some form of depression each year, while in comparison, around 6 million males experience depression each year.
Depression causes a loss of motivation, depending on the severity of the illness. Loss of overall enjoyment in life. Everyday tasks like eating or doing work becomes a burden. Individuals will often just lay in bed for hours on end. This constant struggle, if not treated properly, will eventually lead to suicide. And currently, suicide is ranked number 10 in the leading cause of death in America. The effects of depression can also have major repercussions in respects to substance abuse, like drugs or alcohol, which in turn will worsen your state. Hence, there is short-term and long-term effects, where it can involve loss of appetite, weight loss, can develop insomnia or hypersomnia, which is oversleeping, where it can contribute to being fatigued and lethargic. Where long-term effects involve malnutrition, where people do not eat enough or become obese for overeating too much. A drop in short-term memory loss can occur, tending to forget things easily.
The stigma behind depression is one of the major reasons why individuals who have this illness do not seek out the proper treatment required. As mentioned previously, women have a higher rate of depression statistically, and this is because females are more comfortable with discussing their problems to professionals or friends, while males, on the other hand, are sort of frowned upon if they admit to any form of weakness. So, according to a survey conducted by the Mental Health Connection in Tarrant County, around 40% of people believe that individuals with mental illness are excluded from the workplace. More than 50% of people surveyed think that mental illness is a result of how they were raised, and around 60% of people think unaffected treatment for depression is just to pull yourself together. Now keep in mind, this is the opinion of a county, which is an area in a state, so this is not the opinion of everyone in the world. So fortunately, we are now approaching an age, 2016, where people are more comfortable seeking treatment regardless of sex.
There are multiple organizations that exist in America. Of those organizations, the Anxiety and Depression Association of America is one of the more recognized organizations. ADA was founded in the 1980s and is one of many non-profit organizations in America that dedicate all their resources to raising awareness and improving diagnosis, cures, and treatments for depression and anxiety disorders. ADA has donated more than $1 million to multiple researchers. The organization also invests in different forms of psychotherapy, which is usually effective and consists of cognitive behavioral therapy, CBT, in which it replaces negative and unproductive thought patterns with positive and realistic ones. Medication can be useful where the treatment consists of selective serotonin reuptake inhibitor, SSRI, and SNRI. Medication can be costly, especially for those who don't have health insurance. Hence, there are some pharmaceutical companies that offer patient assistance programs. The programs provide the medication with very little cost, which relates to an upstream approach. Where contributing factors are socioeconomic background are for those who are disadvantaged and don't have the resources to gain the medication. As well as other steps in gaining help can involve joining a support group, where they provide assistance on how to deal with depression and gaining help when you want to.
Here are some natural tips to help alleviate the stress of depression. Now, obviously, there are medical treatments involved with depression, but we're not going to be discussing that. Natural tip number 1 is exercise. Anything from cardio to weight training resistance will help you. If you commit yourself to training hard and eating right, you'll find that living a healthy lifestyle will help you exponentially. Furthermore, according to the Black Dog Institute, 2 trials have found that 16 weeks of regular exercise is as equally as effective as an antidepressant medication, which treats mild to moderate depression. The second natural tip is meditation. And although not a legitimate cure to depression, it does in fact help you clear your mind. And one of the effects of depression is lack of concentration. So what you want to do is sit in a position where you feel most comfortable, close your eyes, try to empty your mind, breathe in and breathe out, and wholly focus on the breathing. The third natural tip is acknowledgement. The first step into solving an issue is admitting that you have one. So tell yourself that you have a problem and go seek help. Once you cross that border of where you want to kill yourself or you find that life is not worth living anymore, that's when you need to seek help immediately. The fourth natural tip is relationships. And I don't mean get a girlfriend or a boyfriend. I mean, you could, but that could worsen the situation depending on who the person is. What I actually mean is surround yourself with people who care about you, who love you, and will have your back. And you'll find that that positive energy surrounding you will help you out in the long run. The fifth natural tip is positive therapy. Now, this requires a psychologist of some sort, and what it does is it focuses on the positive aspects of your life rather than the negatives, which in hopes will instill positive thinking that could help you with future endeavors. And the final tip, probably the most important in my opinion, is pets, more specifically dogs. Dogs are a great way of sort of alleviating the stress of depression. It brings happiness, instills positive energy, and there's a great website that goes into detail on how exactly it helps. It's called Dogs for Depression. And there are tons of studies and cases that have shown that dogs can in fact help patients who have depression. Okay, so the final question is it working? Like anything you commit yourself to, it's going to take time. Depression may not go away completely. It may come back in episodes, it may not even go away. It all depends on the severity of your condition. However, rest assured, statistically, around 80% of people who do receive treatment recover from depression. And of course, medical treatment is not necessary unless the issue is severe. And usually you'll find that talking about your problems and surrounding yourself with people you love will indeed help you. Alright, so that's the presentation. Thank you for tuning in.